Welcome to San Diego Made, San Diego Proud. I'm Allie Wagner. We are celebrating business members who have helped define San Diego as America's finest city. With me this morning is Dr. Richard Saxon from Tri-City Medical Center. Welcome. Thank you for joining us.
Thank you for having me.
Now, today we're going to talk about peripheral arterial disease. That's a mouthful. Tell me what that is.
So that is a disease of the arteries to the legs causing a blockage. It's the same disease that causes heart attacks when it blocks the heart arteries, or strokes when it blocks the arteries to the brain.
Now, you have helped develop, and you guys have a new drug-coated stent. And what does that do? Why is that important? How is that helping people?
So often the way we treat people who have pain in their legs when they walk, or who have developed ulcers on their feet, or rest pain at all the time in their legs from these blockages, we open up the arteries from the inside, doing an angioplasty or putting a little scaffolding or stent inside the artery. But in the arteries in the thigh, that often fails within a year. About 50% of patients will re-narrow within a year.
Ouch.
So this drug on the outside of the stent that just got approved cuts that failure rate in half. So the patients will do much better with less re-intervention.
So you talked a little bit, obviously this makes a big difference, but what kind of people does this affect? Who is it that has these problems in their legs?
So peripheral arterial disease affects about 20% of the population over 70. So as you get older, your arteries get diseased. But the risk factors include diabetes, high blood pressure, high cholesterol, and smoking, of course.
And where can patients go to get more information about this? I mean, how can they get in touch with you?
So they can get in touch with me through the 800 number at Tri-City. I work in multiple places throughout the county, but we have this research program there and sort of pioneered this in the county. I have a coordinator there that they can talk to, and we can get them more information about what's important about this stent.
Now, you said that you are one of 3 places that offer this stent, right? Tell me how new it is.
Yeah, it's brand new. The FDA just approved it a few months ago, and it's being rolled out very slowly. And so since we were one of the sites on the trial that got the device approved, and I was sort of one of the principal investigators, we were the first place to start using it in Southern California. It's going to be rolled out to the other hospitals around town here over the next couple of months. It is something we've used now for 10 years as part of the trial. So.
Now, as the expert for this, once again, you said with the drug coating, I mean, that makes all the difference, correct?
It's made a huge difference in the heart, in the coronary arteries, and this is the first one ever approved for the legs. So all of the stents we've had up till this time have just been bare stents, and this hopefully will, especially for patients that have recurrent procedures and have failed other techniques, this may really offer a lot of hope.
And this helps a lot of older people too, correct?
Yeah, you know, patients can't walk when they have this disease without getting a lot of pain in their legs. They can go a little bit, but then the legs start to hurt, and they have to stop. And then if it gets really bad, their legs hurt all the time, and they develop ulcers on their feet.
Now tell me one more time about how people can get in touch with you and how they can get more information.
So I have a research coordinator and clinical coordinator at Tri-City, Lori Stewart and Susie Cretney, and they can get through to them just by trying to reach me through Tri-City switchboard and the 800 number that they're showing, I believe. And then we can get them more information.
Awesome. Well, thank you so much for joining us today. We really appreciate it. Some great information.
My pleasure.
All right. Well, that's going to do it for San Diego Made, San Diego Proud for today. We'll see you next time.